So, today we start learning about bones of lower limb, ossa membri inferioris. And we have hip girdle, ossa cinguli membri inferioris, and three lower limb bones, ossa membri inferioris liberi. Hip girdle, it's only one paired bone. Hip bone in Latin os coxa consists of three bones, fusing one bone during adolescence. So what three bones? This is ilium, os ilium, pubic bone, os pubis, and this is ischium, os ischii. When three bones fuse together, it forms this structure named acetabulum. Acetabulum for femur. Inside acetabulum, this smooth surface, this is lunate surface, facies lunata. In the center is pit, fossa acetabuli, and this is groove or notch, sulcus acetabuli. All the three bones form this opening, obturator foramen, foramen obturatorium, and here is groove, sulcus obturatorius. First bone, ilium, os ilium has this part is body, and this is wing, ala ossis ilii, and this is corpus, ossis ilii. On the inner surface, we have pit, fossa iliaca. Here we have, this is smooth surface, looks like ear, auricular surface, facies auricularis, and here is tuberosity, not smooth surface, tuberositas iliaca, and the same we have on the sacrum. So auricular surface and auricular surface together form joint, and behind we have two tuberosity, four ligaments. Next, on the border of wing we have spine, spina iliaca. In front, spine finished with crista iliaca. In front and finished with spine. This spine in front, but one more is in front too. So, spina iliaca anterior superior, spina iliaca anterior inferior. Behind crest, crista iliaca ends with spine again, and also two spine. Spina iliaca posterior superior, spina iliaca posterior inferior. Now pubic bone. Os pubis has again body and two branches, upper and lower. When body of pubic bone fuse with ilium, forms elevation, eminentia iliopubica. This branch upper, branch in Latin ramus, ramus superior ossis pubis, and this is ramus inferior ossis pubis. Above branch we have like line, like crest, pecten. Pecten ossis pubis continue to the ilium with arcuate line, linea arcuata. On the end of pubic branch we have this tubercle, tuberculum pubicum. Something here. And this is lower branch. Now ischium. On the ischium we have body, corpus ossis ischii, and only one branch, ramus ossis ischii. On the branch we have this very big tubercle. We sit on it. So tubercle, very big tuber, tuber ischiadicum. And big spine, spina ischiadica, that border two notches, greater sciatic notch, spina ischiadica major and spina ischiadica minor. So, after hip bone we have femur. Femur os femoris is long tubular bone. This is body, corpus ossis femoris, and this is two end, upper and lower, extremities superior, extremities inferior. So, or you can say proximal epiphysis, distal epiphysis. proximal epiphysis has head, caput, ossis, femoris. On the apex we have pit, fossa, capitis, ossis, femoris. For this pit we have ligament beginning from this fossa to this fossa. Behind head we have narrowest part, neck. So what is apophysis? Apophysis for ligaments. This is two big tubercle named trochanter. Greater and lesser. Trochanter major, trochanter minor. Between them behind is crest. Crista intertrochanterica. In front is line. Linea intertrochanterica. On the posterior surface of femur, here is asper line, linea aspera, consists of two lip, labrum mediale, labium laterale. Above lateral goes to the greater trochanter and form, do you see, a little elevation. So this is not line already, it's already tuberosity, gluteal tuberosity, tuberositas glutea. And medial lip goes to the lesser trochanter, and this is still line, pectineal line, linea pectina. Here we have pecten, and this is linea pectina. Between them we will have muscle. Below this line to lip go to the itself structures. So on the distal part we have two condyles, condylus medialis, condylus lateralis. Between them is fossa, fossa intercondylaris. Behind is surface, behind knee, bordered with two lines and condyle. This is facies poplitea, behind knee. In front, surface for patella, facies patellaris. Laterally from condyles, we have epicondyles, epicondylus medialis, epicondylus lateralis. I said patella in front. Patella is here. So, patella has facies anterior, apex patellae, basis patellae, and behind four joint, facies articularis. Patella is the biggest sesamoid bone. Sesamoid means inside ligament. Next, after femur, we have tibia. Close to the tibia, we have, yes, fibula. Laterally. So, at first, tibia. Tibia is long tubular bone. This is body, corpus tibia. This is proximal part. All this surface is upper articular surface, facies articularis superior. Between consists of two parts. These are condyle, condylus medialis, condylus lateralis. Between them elevation, eminentia intercondylaris. In front of eminence, this place area, area intercondylaris anterior, area intercondylaris posterior. And one more epiphysis, because fibula attached to the tibia. On the lateral condyle below we have articular surface for fibula, facies, bless you, facies articularis fibularis. Now apophysis for ligaments and muscle. In front we have tuberosity, tuberositas tibia or tuberositas tibialis. Behind oblique line, this is point of attachment for musculus soleus, linea musculi solei. Body is trihedral, margo anterior, margo lateralis, margo medialis. Facies anterior, facies medialis, facies posterior. Inferior part. So that was facies articularis superior. Now facies articularis inferior. Also we have notch for fibula, incisura fibularis, and this process is a special name. This is malleolus. Translate like ankle. Malleolus medialis. With the fibula it formed common articular surface. Here, common articular surface. So for fibula, For fibula, you should know only this is head, corpus fibulae, and malleolus. Malleolus now lateralis. Malleolus medialis, malleolus lateralis. On the head, you can also say apex. Apex capitis fibulae. So, this is common articular surface. Yes? For next part, for foot. Yes? This is talus with trochlea tali. So, bones of foot. Foot in Latin pes. Bones, ossa pedis, consist of tarsus, tarsal part, metatarsus, and phalanges. Tarsus again, proximal, distal, and 5 distal bones. So, talus and calcaneus first. This is talus. Talus has. This is head, caput tali. Behind is neck. Head looks in front. So, this is head in front. Above, on the body, on the corpus tali, this is trochlea tali. Below is articular surface for next bone, calcaneus. This is calcaneus. Calcaneus has articular surfaces for talus, and behind is very big tubercle. This is tuber calcanei. On the tuber, you can find a little tubercles, tuberculum, tuberosity. Together, all of this is tuber calcanei. And one more special part here, mediali. Mediali, calcaneus has holder of talus, support. So, sustentaculum tali. Sustentaculum tali. And you see it form groove with talus. This groove for tendon. Tendon of muscle. Muscle for toe, hallus. This muscle is flexor, and this is long flexor. Musculus, sulcus, tendinis, musculi, flexores, hallucis, longi. One more time. Groove for tendon. Sulcus tendinis. Tendon of muscle. Sulcus tendinis musculi. What muscle? Muscle of toe hallucis. This is flexor, and this is long muscle. Sulcus tendinis musculi flexores hallucis longi. Sulcus tendinis musculi flexores hallucis longi. So in front of talus we have naviculate bone, os naviculare. In front of calcaneus we have cuboid bone, os cuboidum. And then we have 3 cuneiform bone, os cuneiforme mediale, os cuneiforme intermedium, os cuneiforme laterale. 3 lateral in the center, medial on the medial side. After tarsus we have metatarsus, and then phalanges. You should know for bones base, corpus, and head. Phalanges we have proximal, medial, and distal, except first. Toe have only proximal and distal. That's all.